Requesting Dr. Shilpa Naik to present a sapling to Dr. Bipin Salkar. Dr. Vidya to present a sapling to Dr. Rajendra Kalikar. Let's acknowledge this thoughtful gesture with a big round of applause. Thank you, everyone. We now move on to the Memento presentation ceremony as a token of our gratitude and appreciation for the esteemed dignitaries and contributors present here today. Let us honor their dedication and efforts with these tokens of respect. I now request Dr. Utkarsh Betorkar, Sir, State Surveillance Officer, IDSP, Director of Health Services, Government of Goa, to present a memento as a token of gratitude to Dr. Chandrakant Shetye, Sir, MLA Bicholim and Chairman, Infotech Corporation Limited, our guest of honor for today. I request Dr. Bipin Salkar to present a memento to Dr. Meenal Joshi, Madam, Deputy Director, National Ayush Mission, Government of Goa. Requesting Dr. Bipin Salkar to present a memento to Dr. Utkarsh Betorkar, State Surveillance Officer, IDSP DHS. Requesting Dr. Rajendra Kalikar to present a memento to Dr. Roshni Shirvaikar, Principal, Shri Kamakshi Devi Homeopathic Medical College and Hospital. I now request our guest of honor, Dr. Chandrakant Shetye, Sir, to present mementos to our speakers. To begin with, we have Dr. Prashant Suryavanshi, Sir. Next is Dr. Ashok Borkar, Sir. And also the students of Midi School of Dance for their spectacular dance performance. I call upon Ankita and Yurani. Thank you so much, sir. It is now my honor to invite Dr. Utkarsh Betorkar, Sir, State Surveillance Officer, Integrated Disease Surveillance Program, Directorate of Health Services, to address this gathering. Dr. Betorkar has been instrumental in leading public health initiatives, including the COVID-19 KFD, and we look forward to his insights. Over to you, sir.
Respected Dr. Chandrakant Shetye, sir, Honorable MLA Bicholim constituency. More than an MLA, for us, for all of us, he's a doctor first, and probably that's why he's the right person today to address us later. Other dignitaries, all the days, and all the homeopathic friends who are gathered here. I welcome you all today, and it's my pleasure to see this crowded, entire hall, and you are present here for this CME on snake bite. And when we say homeopathic medicine, whether there is a role in a snake bite, we'll come to know today after we are the two esteemed speakers speaks today in front of us. What is the role of snake bite and what is the role of homeopathy in a snake bite management? And what is the role as a overall as a homeopathic physician when it comes to giving a care when it comes to snake bite to our communities? Now, just to start the topic of snake bite today, let me just give you a facts what WHO says about snake bite. Snake bite is there for ages, right? But then hardly we speak about snake bite and its management. We rarely speak about it. We speak about all other topics. Vector-borne diseases, COVID came, so much of big noise and so much we did for COVID. Now we are worried even about HMPV, but we are not worried about snake bites, right? Which is killing a lot of people, which is even a cause of a lot of morbidity, forget mortality. Okay. So what WHO says is almost every year around 5.4 million people are bitten by snakes. And out of these, almost 80,000 to around 1.37 lakh people die of snake bite. Above this, almost 4 lakh or more than 4 lakh people have a morbidity which leads to paralysis or amputation due to snake bites. So it's the topic. Actually, if we see, the burden is huge globally. What is the scenario in India? Now India, as per the estimate, what it says is 3 to 4 million cases and more than 50,000 deaths due to snake bites. But what is reported right now is very, very low. If you see CBHI data, it says around 2,000 deaths only of snake bites. But then estimated is around more than 50,000. So we know very less about snake bites when actually if we see, remove our papers and data and see, we know very, very less about snake bites, what is happening in India or globally. So keeping this in mind, even at WHO level, there is a goal which is fixed till 2030 to decrease deaths due to snake bite by 50%. And taking this goal forward in India at national level, there is a program which is started last year, a national program on control and prevention of snake bite and envenomation. Now, despite of all these numbers, snake bite is still called as neglected tropical disease. Who is worried about snake bite right now is the person who gets bitten and the person who is treating them at various locations, whether maybe it is PSC, district hospital, GMC, or even in a private clinic. When it comes to GMC and district hospital, doctors are a little more relaxed because there is a care which is available, there is an expertise which is available. But what happens at PSC level? So at PSC level, there are lots and lots of doubts. The doubt starts right from what is a snake, identification of snake, whether it is a poisonous, non-poisonous. What do I do now next? My PSC is much far from district hospital or GMC. Do I refer him directly? Okay. Whether I can keep him in my PSC for observation or not. So all these doubts, even if after I test, when do I give him ASV? How much do I give him as ASV? If I give him ASV, again he will have a complication due to anaphylaxis or not. ASV as such is available even till the last PSC. But then the confidence will come only when we know more about the management, more about what is happening currently, more about the knowledge of when to give, how to give, all these queries. Okay. So all these doubts from our medical field especially needs to be removed, and that is why this CME is being called today. So that as a homeopathic physician, you take this back message to your other colleagues, to the communities, the first-hand knowledge about the snake bites, and then comes to the management. Now, this program which is started, National Program on Prevention and Control of Snake Bite, has 3 major objectives. One is about training all our health staff. That means right from doctors, nurses, paramedics, everybody. Second is about ensuring availability of the anti-snake venom till the last point where patients are coming to us. And then thirdly, to educate our communities and general public. If we need to do all these 3 things together, what is needed is to, we as a healthcare workers, to be aware about snake bites properly. We should not have doubts in our mind. If you remember about rabies program, if you go back 10 to 12 years back, when rabies program was not full-fledged launched at national level, we were giving rabies treatment for ages, right? For decades we are giving treatment. But then there were doubts. But if you see now, present day, the rabies vaccine as well as immunoglobulin is available at all PSC level till GMC. There are very, very few doubts. Now we have done so many programs or talks on rabies that all these doubts have come out from the people whom we have spoken to, and then we have got answers to those doubts. Now, something like this needs to be done for year to come with respect to snake bite. So let's take these opportunities, let's hear from the experts today, and then have doubts, whatever doubts are there in our minds, let's clarify those. So at this moment, let's think about our first interaction with respect to snake and snake bite management. Think about whenever you have seen a snake and you got a doubt in your mind whether it is poisonous, non-poisonous, whether you could not identify, you were asking people what it could be. Think about a scenario where you have treated a patient. Think about something like where you are nearby or your family members, friends, somebody has got a snake bite and you got a call. What do I do next? Keep all those doubts in mind and then listen to this talk today. And clarify all those doubts and then leave the hall today. Okay? Thank you. I expect a lot of questions from you and a good interactive session today. Thank you.
Thank you so much, Dr. Utkarsh, sir, for your valuable address and enlightening us on the current scenario of snake bites and the importance of the CME for the day. It's an honor to have with us today Dr. Chandrakant Shetye, MLA of Bicholim and Chairman Infotech Corporation as our guest of honor. I now invite Dr. Shetye, sir, to address the audience. Please join me in welcoming him with a round of applause.
Good morning, everyone. For today's snake bite CME, I think this is organized in association with Director of Health Service and the Homeopathic Board. With me here, the Deputy Director, Director of Health Services, Dr. Joshi is there, Dr. Bipin Salkar is there, Dr. Utkarsh Shetye is there, Principal, Dr. Shirgaonkar, Speaker, Dr. Borkar, Dr. Prashant, Dr. Kanekar, all my colleagues, doctor colleagues, press. First of all, it's really indeed it is an honor for me to be here with my own community. You feel different when you are with your own community because the talking level differs when you are with community. And today's topic, as rightly I was listening about Dr. Utkarsh, this thing about snake bite. I know it's a very important disease, you can say, accidental disease, you can say. And yet, it has been not highlighted or taken seriously, like what precaution we should take it to prevent it or how to manage it. What has happened, there are so many issues in our societies. Unless that issue, we highlight it, we brand it, that importance doesn't come. Though we know, Dr. Utkarsh will be in a better position to tell you the exact data. See, we take importance of any illness when you know the data. Like how many people have suffered this year, last year, or last 10 years. Once you know that data, we know about this many, 500 people, like I was just talking to Dr. Utkarsh, around 500 people are having a snake bite every year. 500 is a big number. Why 500? To have a single death because of any accident, we take it very seriously. It is not that we take it very lightly. I don't know, when I was in GMC, when it is still then, we used to have a monthly meeting, and even one death, which is reported, not because of a routine thing, some medical negligence, it has to be taken for a discussion. And everything was, discussed. Actions were taken, find out why it is there. So one death for a doctor is also very important. For a simple reason I am telling you, in your practice, if one wrong thing happens in your full career, it is enough to have it. You must have heard, you must have read in papers. So one that also you have to take it very seriously as a doctor. First of all, let me congratulate the Homeopathic, Association for having CMEs. CMEs are always important. As a doctor, we all have one thing in common. What is that? Interest of patient, interest of society, interest of public. So that is which is common to us. And I'm sure after attending these CMEs, you all must be good in your subject. All must be having the excellent knowledge of snake bite, type of snake bite, poisonous, non-poisonous, different type of snake. What is the emergency treatment? What is the preventive measures we can take? Where to refer? Everybody. But I'm sure you all, both the experts today will have it, definitely will enlighten you. You almost have so many doubts. They will clear your doubts. So after finishing this year, when you will be leaving this hall, definitely any doctor who attends CME takes some extra points and goes. So that is the importance of CME. So my request, not now and henceforth also for all of you all, whenever any CME is there, please do attend. For doctors or for anybody, age is not a limit. Even if tomorrow I become 70 and if I attend some CME, there's a lot to learn. Every day there are new things. You all must be thinking, after joining politics, I have forgot my ophthalmology. Absolutely not. Today also I operate. I don't know how many you all know. And I do maximum practice. In fact, after joining, my practice has increased more. Every day I do around 15 to 20 operations. I don't know. So I don't leave my hospital in the morning hour. Never. It is 8 to 3. I am always in the hospital. I work from the hospital. I take my, whatever it is, my constituency, political staff in the office there are. They manage it. You should know to manage. So what I mean to say, never miss a CME. See what has happened so many times, we attend CME only because for those credit points. I don't know, but our association, we require to have 30 credit points for 5 years to renew our license for allopathy. I don't know about your homeopathy also, there is a credit points in that.
It's gone for the implementation.
It is gone for the implementation. Don't attend for credit points. See one thing, this profession is such, believe me, take this message correctly from me. You do it from heart, you will never have a deficiency of patience. Mark my word. Manatlan kara, itle kara ki that patient, when it comes in your cabin, the patient should feel, this doctor is for me only. He doesn't have anything in mind. This doctor has forgotten about his family, about his surrounding. Doctor and patient, that's all relation. And the doctor should feel, the patient should feel, this doctor will do each and everything for that patient. You know what? I had a doubt after joining politics, and so many people advise also, my seniors, wow, you want to join this politics and all, you are having such a good practice. One of the best practice means I can boast now also, then also. I got #1 practice ophthalmology. I don't know whether you all know. My number surgical is so high, even if I just operate, it's enough for me. That's what I'm doing. So I had a worry that now patient will not come. They will say doctor has become MLA and all. Why did he come and all that? I had a worry. But believe me, whenever I go to hospital, I go Monday to Friday. My timings are only Wednesday evening. Today evening I will be doing OPD. Otherwise 8 to 3. Whenever I am there in a hospital, whether it is a holiday or whatever, my OPD is always full. Appointment you will not get 1 month back. But that doesn't mean, though my appointment is 1 month back, but if somebody calls me in the morning or the hospital emergency, I never say no to patient. At this period also, even on Sunday some emergencies there, my other consult, I have got some 7-8 consultants, 8 ophthalmologists I have got. I still attend an emergency call. And you know how much I take for that emergency call? If I come to hospital to remove foreign body, usually emergency are foreign body, it's rarely. I hardly charge 500 to 700, my consultation on that. But question of that money is not important. See, that patient always remember, that night on that Sunday only Dr. Shetye came and solved my problem. That patient becomes mine forever. So what I mean to say, if you work now, see as a doctor, I mean some of you all in government service, they will get pension. Otherwise who are working in private, we don't have pension, no salary, nothing. What our pension or this is the faith, is the goodwill which you build with this patience. So my worry was that I won't have patient, but what I have worked last 22 years, all that is repaying me now. They come in that faith. So my request to all of you all, upgrade your knowledge. Any subject it might be. Most of you all think, a snake bed when I'll get once a year, 1 patient. But that 1 patient can change your life. As I said, 1 patient, bad patient can damage you. 1 patient, that will give you bad, good. And one thing you believe, whatever profession you take, you have to live with this profession. You have to live as a doctor, you have to die as a doctor. So why not to have the best knowledge in this subject? What is wrong in having the best knowledge? And best correct knowledge, only an expert can give you, a book can give you. You know, to give a talk on any subject, how much trouble that speaker has to take. You all all of you all must have last night good dinner, nice sleep and come. Poor speakers, they know they wanted to speak with the doctors. So they were like, doing all the latest studies. Because one of you all get up and ask, tell me what is the statistics last year? How many types of poisonous snakes are there? You can ask any question, no? Huh? What types of is there any new studies have been done? New thesis has been done, new antivenomous this thing has come. You can ask anything. So poor, what are these? So that's why whenever you all go for CMEs, whenever you all goes for CME, please attend. It is not that easy, madam, to talk on any topic. You need to really academically give the latest knowledge. So that's why I'm very smart. I'm not speaking anything on snake bite. Basically, I would love to speak. Frankly speaking, when I was coming, I told my other colleague, I want to know about anti-snake. So I got all the data. Frankly speaking, I want to speak because experts are there. I can tell you, and that way, I love to read my books. But on this chair, my only thing is that all of our work should help the society. Society should be our point focus. Anybody who get help because of my knowledge, you should feel, and always, in this profession, whenever I don't know about my style of working, you all must be, all of you all are good on Facebook, Insta and all. I am hardly on that. If politically I am there, then my political team is doing. Personally, I am hardly on Facebook, Insta, hardly. Because I don't handle also my thing. And before joining politics, I never had Facebook and all like that. So what I want to say, you do such a good work that let your work speak. I know all this Facebook, Insta, marketing, all that is a part and parcel. I'm not against that. But work stand the best. And at least in Goa, I don't know. Goa, if you see, I'll openly make this statement. Which doctors are doing good? Goa, if you see, all nursing home and hospital are doing, but corporates are not that doing well. In fact, whichever corporate are closed, except for Manipal. But it took 4 decades to come to this level. Whereas other hospital, whoever individual hospital, they are doing excellent. Why? Because in Goa, it's a small. Goa is a different state altogether. We have got 15 lakh population. Each one knows everyone. Even if I stand here and tell something, everything. Many of you all know, you all have been my patient. Everything else. I need not tell who am I, what I am doing it. So Goa, how people approach a doctor is mostly by their name, their expertise, their knowledge, what is the treatment. So Goa is a bit different scenario. So here, I personally feel marketing and all has got not that much scope. Okay, initial 6 months is required. But tomorrow one of you all, like good in handling a snake bite, all people will come from any corner, whether it is from Pernem or from Karwar. Wherever you are there, if you are sitting under the tree also they will come. Don't laugh, you all must be knowing so many homeopathic Ayurvedic doctors, they are doing so well. I don't want to promote or tell their name. They are sitting in one corner or other corner of Goa, people go to them. You all must be agreeing with it. If you all want name which doctors are doing very well, I'm not talking of allopathy, homeopathy, Ayurvedic, you can meet me outside this all, I will tell you. So what, this thing is that, upgrade your knowledge. Be kind to people. And always think, yes, I will be best in my subject. When it comes to ophthalmic patient comes to me, everybody wants that I should treat. I always tell them, I am only good in cataract. Rest thing, my other consultant will tell. Yes, cataract, you speak to me anything, anytime, anywhere, and you ask me the result, I will give 110% result. I'll tell you, this is this. And when you are good, you should be so good, you should be good nationally. You should be good at competitive national level. Why nationally? You should be good at international level also. Yes, I can speak on this topic. This is this, this is this. And enjoy your profession. Everything will follow the same thing. Money will come, political career will come, business will come, everything will come, followed by that. So that is the reason I don't leave practice, because I know everything has followed after my practice. I'm sure you all will. I'm sure you all understood what I want to say. What I want to pass the message. And always one thing, we always consider as a cream of society. Just only don't think of cream of society. Give it back to society. Nothing, kuch kam nahi hota hai. It will come more. And I think if you follow this simple rule, I think you all must be better than me. I need not tell you all. I'm just telling certain my experiences. I think then the life is simple, I think. Life, you should not make it complicated. I always tell in any this thing, life is very simple. Night time, eat, sleep. Full day, you do your work and sleep. What is that? You only create problems for us. So don't create problems. Be happy. Enjoy your CME. Thank you. God bless you.
Thank you so much, sir, for your enlightening words, focusing on the significance of clinical data tabulations, trend analysis, and upgradation of knowledge, and working upon each self as a doctor and giving it back mainly to the society. Thank you so much for your